So you've got your new Ozempic pen, and you're probably wondering, okay, what now? And that's totally normal. We're going to break it all down for you, simple and step by step, using the official patient info so you can feel completely confident. So here's what we're going to cover. First, getting started. Then, how to store your pen, what to do if you miss a dose, some really critical safety warnings, and finally, an important heads up about Ozempic and birth control. All right, let's dive right in. First things first, getting started. We're going to cover the basics so you can feel totally confident right from the get-go. Okay, this is probably the biggest question on your mind, right? How do I actually take this? It's the question everyone has. Let's walk through it. And trust me, it's way simpler than it sounds. The name of the game here is routine. It's just once a week. That's it. Pick a day, any day, maybe it's Sunday, and make that your Ozempic day. Super easy. You can do it with food, without food, whatever fits your schedule. The important things to remember, it's an injection just under the skin, and yep, never ever share your pen. When it comes to the actual injection, just think of it as a simple 1, 2, 3. 1, pick your spot, your belly, your thigh, or your upper arm. 2, inject it, just like your doctor or nurse showed you. And 3, this is a big one, make sure you rotate where you inject each week, so a different little spot every time. That's going to help keep your skin happy. Okay, so you've done your first injection. Awesome. Now what do you do with the pen? Let's talk about storing it correctly, because you want to make sure the medicine stays effective. This is actually super straightforward. Before you use a pen for the very first time, it has to live in the fridge. But once you've started using it, you've got options. You can either pop it back in the fridge or just keep it at room temperature. Easy peasy. Just make sure you put the cap back on to protect it. Okay, I want you to burn this number into your brain. 56. 56 days. The moment you use that pen for the first time, a clock starts ticking. After 56 days, you have to toss it. And I mean it, even if it looks like there's still some medicine left in there. It's a hard and fast rule. All right, let's be real. Life gets busy, and sometimes we forget things. It happens. So what do you do if you miss a dose? Don't panic. There is a super clear, simple rule to follow. Just remember this, the 5-day rule. It's that simple. If you're within 5 days of when you were supposed to take it, just take the missed dose as soon as you remember. But if it's been more than 5 days, forget about it. Just skip it completely and wait for your next regularly scheduled day. No need to double up. And this is a really important point. It's kind of the golden rule for any medication, really. Never ever change your dose or just stop taking it on your own. You've got to talk to your doctor first. Think of them as your partner in all this. Okay, we're going to shift gears a little bit now to something more serious, but it's so important. We need to talk about safety warnings. Look, knowing what to watch out for is all about keeping you safe and in the driver's seat of your health. Really, this is all about being empowered. When you know the signs, you know when to act. So let's get right into what you need to look for. If you experience any of these things, it's a call your doctor right away situation. We're talking about severe stomach pain that just won't quit. That could be a sign of something like pancreatitis, or maybe a lump in your neck or your voice getting hoarse. Also, severe vomiting, signs of low blood sugar like feeling dizzy or confused, and definitely any changes to your vision. Don't wait on these. Now, there's one really specific warning that you have to know about. Ozempic comes with a warning about a specific type of thyroid cancer called medullary thyroid carcinoma, or MTC. So because of that, it's an absolute no-go for anyone who has a personal or a family history of MTC or another rare condition called MEN2. All right, we're on to our last section, and this one is a big deal, especially for anyone who takes birth control pills. We have to talk about how Ozempic can interact with them. So let's just get straight to the point. Can Ozempic mess with your birth control pills? The short answer, yes, it might. And it's super important to know why that is and what you need to do about it. So here's how it works. One of the things Ozempic does is it slows down how fast your stomach empties out. Now, think about it. If things are moving slower through your system, it can change how your body absorbs oral medications. And that includes the pill, which could mean it's not as effective as it should be. So what's the game plan? It's simple. You need to use a backup method of birth control, like condoms, for 4 weeks when you first start Ozempic. And then you've got to do it again for another 4 weeks anytime your doctor bumps up your dose. Every time the dose changes, that 4-week backup plan kicks in again. And listen, if you're thinking about planning a pregnancy, the guidance here is crystal clear. You need to stop taking Ozempic at least 2 full months before you start trying to conceive. That's a non-negotiable time frame. Look, we've gone over a lot, and hopefully this has been super helpful. But please remember, this doesn't replace talking to your own doctor. They know your health history, they're your #1 resource, so always keep that conversation going with them. You know, when it all comes down to it, here's the bottom line. The more you know, the better questions you can ask. It's all about taking an active role in your own health. You really are your own best advocate. So, as we wrap this up, I want to leave you with a little homework. Think about everything we've talked about. What's the one thing that's on your mind right now? What's the one question you're going to make sure to ask your doctor next time you see them? Keep that dialogue open.